A glimmer of hope is becoming clearer as the COVID-19 vaccine made by BioNTech and Pfizer has been highly effective at preventing infection in Israel, according to the first real-world data showing that vaccination stops transmission of the virus. The results gathered by Israel's health ministry showed that the vaccine was 89% effective at preventing infection of any kind and 94% effective against symptomatic infection. The new data, which has not yet been peer-reviewed, provides the first real-world demonstration of the vaccine's effectiveness and offers hope that those immunized will also help to stem the spread of infection. The initial clinical trial run by BioNTech and Pfizer found the vaccine was 95% effective in preventing disease, but the real-world data provide more insight. The study was conducted in the 3 weeks to February 6th, during which the BioNTech-Pfizer vaccine was the only shot available in Israel. At the end of that period, more than 27% of all people in the country over the age of 15 were fully vaccinated. Among those hospitalized in a severe or critical condition during the study, 4.4% had received both shots and 5.7% of those who died from the disease were fully vaccinated. Overall, the vaccine was 93% effective against preventing hospitalization and death. During the study period, the B117 variant first discovered in the UK was the dominant strain in Israel, found in more than 81% of COVID-19 test samples. Israel signed a deal with Pfizer to get more doses in exchange for studying its population as it gets vaccinated. The country has administered doses to more than 78 people per 100 residents, one of the highest rates in the world, according to the FT vaccination tracker. In a further boost for the BioNTech-Pfizer shot, the company said this week that their vaccine no longer needs to be kept at ultra-low temperatures, making it easier to distribute to clinics, pharmacies and more remote regions. Stability data, which the companies are submitting to regulators around the world, show the vaccine can now be kept at normal medical freezer temperatures of between -15 degrees Celsius to -25 degrees Celsius for up to 2 weeks, compared with the previous required storage conditions of between -60 degrees Celsius and -80 degrees Celsius. COVID-19 infections among hospital workers have fallen by 90% since vaccines were rolled out to frontline staff, outpacing the rate of decline in cases among the general population, new figures show. The UK's rapid rollout of coronavirus vaccines have also begun to show up in the official figures on infections, hospitalizations and deaths. Improving in the data for the vaccinated, over 80's population are outpacing those for younger people. The threat comes as Boris Johnson, the Prime Minister, prepares to reveal on Monday the government's roadmap out of the current lockdown, using data, not dates, to ease the current restrictions. The vaccine effect taking hold of the UK has succeeded in delivering a first dose of COVID-19 vaccine to more than a quarter of the population, with only a handful of countries, such as Israel and UAE, inoculating a greater proportion to date, with more than half of the people aged 80 and above having received their first jab by the middle of January. Case rates, hospitalizations and deaths in this group of people have started to drop faster than the rest of the population. Ghana recorded 506 new COVID-19 positive cases, with deaths at 582 as of February 23, 2021. These figures by the Ghana Health Service now sends Ghana's total confirmed cases to over 80,759. So far, 73,365 persons have made recoveries, leaving the active cases at 6,812. According to the latest update, Greater Accra region, which has cumulative cases of 46,328, remains by far the most infected region, with Savannah reaching the least infected with 72 cases. Meanwhile, the National Commission for Civic Education (NCCE) has planned in the coming weeks to embark on intense public sensitization about Ghana's COVID-19 vaccination strategy. The country is expected to take delivery of some doses of AstraZeneca vaccines to immunize sections of the population against the coronavirus by March this year. In a statement which outlined a series of activities it intends to embark on this year, the Commission said it will collaborate with the Ghana Medical Association (GMA) to carry out public education on the introduction and administration of the vaccines. Alongside the vaccination campaign, the NCCE said it will continue with its public sensitization on strict adherence to the COVID-19 safety protocols and destigmatization. It said it will target schools for design and distribution of posters, flyers, stickers and other civic education materials to constantly alert students of the pandemic, which remains a global health crisis. The statement said the Commission has commenced outdoor outreaches on the mandatory wearing of nose masks, and this has been intensified following the rise in number of COVID-19 cases in the country. Adding that the NCCE will be seen on the streets, market centres, lorry stations and terminals, engaging citizens on the need to adhere to these safety protocols. Other areas the NCCE will focus on in the year include public sensitization on role of members of parliament, MPs, promoting political tolerance during and after the ongoing election petition, and upholding respect and integrity for the judiciary. The NCCE noted that civic education was a shared responsibility and charged all and sundry to promote the subject in every sphere of life. The Commission, however, hoped for timely release of funds for the NCCE to fully implement these citizen-centered programs to stir up civic consciousness among the people of Ghana.
The Minister-designate for Finance, Ken Ofori-Atta, has been rescheduled to appear before the Appointment Committee in Parliament on March 8, 2021. This comes after Ken Ofori-Atta's request for postponement of his initial date due to complications from COVID-19. The Ministry of Finance last week announced Mr. Ken Ofori-Atta was leaving the country to the United States to seek medical care, hence the need for postponement of his initial scheduled date for vetting. The Finance Ministry in a press statement said, after recovering from the COVID-19 last December, Mr. Ofori-Atta has had medical complications, which doctors advise require further interventions not currently available in Ghana. He is expected back in Ghana in 2 weeks, the statement indicated. Meanwhile, the Ministers designate for Sanitation Resources, Public Enterprises and Transport, Cecilia Benadapam, Joseph Kujo and Kweku Ofori-Esiama, respectively, are expected to appear before the committee on February 23, 2021.